episode of How to Survive Healthcare. I'm your host, Kayla Thompson-Riviere. I'm a registered nurse turned independent patient advocate, here to bring you my best tips and tricks for advocating for yourself and having a positive healthcare experience here in the broken U.S. healthcare system. Please note that this show is never intended to be a substitute for medical advice, but is instead meant to educate and empower you through your healthcare journey. So today's topic, can you trust your doctor? So this actually comes from a little bit of a personal story / inspiration. So I am about 8 months pregnant, and I stumbled upon this video the other day. It was a reel made by a doula, and it was a skit. And in the skit, she was pretending to be a patient who'd been in labor for a while. And the doctor came in the room and said, "Hey, I think we should start Pitocin." And she asked if there were any risks, and the doctor was like, "No, not really." And then she fired back and said, "Well, actually, I already know about Pitocin, and I know that the risks are XYZ." And the doctor really didn't have a good retort. So I am in a due date group on Facebook, which means all of us in this group, we're all due with our babies around in the same month. And I thought it was an interesting video to help highlight how you don't always get all of the information from your doctor, and it's really in your best interest to educate yourself about potential interventions that you may need for your medical condition so that you can make some informed decisions. Unfortunately, not everybody had the same viewpoint on that video as I did, which of course that's to be expected. I mean, it's the internet. But I just want to share a few comments. I had one lady on there said, "I'm a first-time mom, and these videos cause me a lot of anxiety. It's hard to draw the line between being informed and focusing on the risks of everything." And then somebody piggybacked off of that and said, "Exactly. These doctors know what they're doing, and I'm going to trust that everything's going to be all right." And I wish that is just how it is. But guys, it's not. It's not. And I empathize. It is scary to educate yourself about the risks of whatever your medical condition may be. In this instance, the risk of interventions with labor and delivery. It is scary to be informed of the things that could go wrong should you accept interventions, medications, or surgeries for your medical condition. But to bury your head in the sand and just blindly trust that everybody involved in your care knows what they're doing and everything's going to be fine, that is way scarier. Because I have seen the way that plays out, and I have statistics to share with you about how that plays out. And it's not into your best interest. So I want to say, first of all, if you should be able to trust your doctor. You should have a trusting relationship with your doctor, your nurse practitioner, your physician assistant, whoever the healthcare providers that you work with on a regular basis to manage your medical conditions. You should trust them. You should believe that, that they have respect for you and that they are working with you to get you better and not against you. If you have a healthcare provider who you feel like isn't taking your concerns seriously, isn't open and communicative, doesn't answer your questions, brushes you off, doesn't seem invested in your healthcare outcome, or gives you any kind of indication that you feel like that they're just trying to squeeze money out of you, those are red flags. Please run. Again, there's an exception to every rule, but you deserve to be able to work with a healthcare provider that you trust. That being said, what I stand against is blind trust. I don't believe that you should ever put full blind trust into another human being, especially with decisions that affect your health and your life. Those decisions should always be in your hands. And when they are in your hands, that means that you now carry the weight of informing yourself about those decisions. It's not the place for anybody else to make, unless, of course, you're incapacitated, and that's what a medical power of attorney is for. But you understand, I think, what I'm getting at. It's not a decision for your healthcare provider to be making. So I want to share some of the statistics around medical error. They are shocking. I will link the sources to all the statistics that I'm about to cite underneath the video. I encourage you to check them out. If you start digging in, you will find that there can be a wide range, kind of depending on where you're getting the information. So I picked some of the median numbers that I could find, or the ones that came up frequently. So on average, about 1.2 million people are harmed by medical errors in U.S. hospitals every year, harmed in some way. So this includes death, dismemberment, serious illness, further hospitalization, some sort of harm from medical error. Medical error does not include side effects or potential complications. That's a whole nother number on itself. These are purely things that were done in error. Additionally, we have of that 1.2 million who are harmed, over 250,000 of them dying from their medical error. When we take a step back and we look at people who receive a diagnosis, either in the hospital or in a clinic or physician's office, we have on average about 795,000 Americans who die or are left permanently disabled by a diagnostic error. So either they were given the wrong diagnosis or a missed diagnosis, which then led to inappropriate treatment or a delay in treatment. Additionally, as many as 30% of surgeries are deemed unnecessary when peer reviewed after the fact. And in our patient population of ages 65 and older, it is estimated that approximately 34% of them are placed on drugs that are considered inappropriate, either that they're having potential interactions, or in the instance of that patient, they can be doing more harm than good. So those are alarming statistics, and there's a lot of reasons why medical error occurs. First and foremost, the American medical system, you may know this, is not set up to the benefit of patients. It's also not set up to the benefit of healthcare providers. I have been a nurse for almost a decade. I've worked in healthcare for over a decade, and I have interacted with a huge number of doctors, nurse practitioners, physician assistants, physical therapists, other nurses, pharmacists, etc., healthcare boots on the ground, healthcare providers. And I would easily say there's just a couple people who I've come across that I'm like, why are they in healthcare? Because they don't seem like they're in it for the patient. The vast majority of your healthcare providers really are there wanting to do a good job for you and help you get better. There's just a lot of barriers in the way. There's a lot of red tape in the system. I'm not exactly sure who it benefits. I have a guess. There's people who make a lot of money off of it, and I assume that that's the reason why things are set up the way that they are, and we need a whole systemic overhaul. That's a whole nother topic. But it's beyond unfortunate that because of systemic issues contribute to the majority of medical errors. Then there's also just the fact that medicine is carried out by human beings, and human beings make errors. And even though, we have come a long way, especially with medications. There's so many safety checks now with medications. It's still not foolproof. And, there's a human interacting at every level. And even for the things that there's automatic safety checks for that take the human element out, there's still You can't train, at this point anyways, can't train a computer program or an algorithm for the nuance of what's going on with a patient at that very specific time and what's appropriate for them. So that's one aspect of it. Additionally, specifically with the statistic that I found about the 30% of surgeries being unnecessary, it was interesting that the surgeons who carried them out actually felt that they were beneficial to the patient. And oftentimes it was related to the physician being kind of unfamiliar with alternatives, or perhaps not super confident in a diagnosis and kind of leaning to, well, let's just do the surgery and then we'll see, as opposed to exploring other options. Another big issue with the medication and that big amount of medication overuse, a lot of that really falls on kind of the overarching patient population. So what I mean by that is that we here in America tend to have this culture that when we go into a physician's office or a clinic or a hospital with a problem, we have an expectation to receive some sort of treatment from that doctor, whether that be a prescription, a referral to another doctor, which usually that one isn't well loved or received by patients, or planning for some sort of intervention like a surgery. There are a lot of things, particularly in our chronic metabolic diseases like diabetes, hypertension, high cholesterol, heart disease. A lot of that can and really should be managed with lifestyle changes. Lifestyle changes are difficult, and people are often very resistant to hear about them and would rather have a pill. So physicians, unfortunately, have been kind of conditioned to going right to that, well, there's a pill for this. And then in addition to that, there is a huge lack of dietary education in the medical school. I haven't been to medical school, but I have been told that to-be physicians in medical school receive one semester of nutrition education. And we have a lot of research coming out that tells us more and more every year about really the role that nutrition plays in our health and the interaction between our lifestyle choices and our health outcomes. And unfortunately, I think doctors, particularly here in America, are in a position where, you know, the patient, there's a lot of weight on patient satisfaction. And while a patient absolutely should be satisfied with the healthcare that they receive, it's also on them, it's also on the patients, though, to be educated about their conditions and understand what's best for them. And it isn't always in a pill. So there's a lot of facets to that. Oh, another big thing is that medicine nowadays, thankfully, is called what's evidence-based. So many years ago, like in the early 1900s, medicine was practiced essentially based on what a physician felt like might work or what they thought had worked in the past. And it was very anecdotal. And then as science and technology continued to advance and improved, we got to this model in the late 80s, early 90s, where we started doing really good research studies around different medical interventions, surgeries, medications, and started to use the evidence from those studies to direct what our medical care should be. And that comes with much better outcomes. So instead of just guessing and taking a jab, we can actually see, oh, the research clearly indicates that when we do ABC, XYZ occurs. The problem is that for when new evidence comes out, it takes on average about 17 years for that evidence to become standard practice across the country. Now, of course, that varies depending on where you are. For instance, if you're receiving care in a large teaching hospital that specializes in the kind of condition that you have, you're probably going to be working with healthcare providers who are informed of the most up-to-date evidence-based care for that condition. Conversely, if you're in a rural location and you have a doctor who, your condition is only one of a handful that they've ever seen, it's more likely that the care that you receive is going to be based on older or more outdated evidence, if it is evidence-based at all, simply because what a healthcare system interacts with more and is more familiar with is going to take the precedence. So that being said, you can have a provider with the best intentions who just is simply not up to date on the most accurate medical things that have come out. And so they could be making recommendations that are not in your best interest based on the newest the newest evidence that there is. So I really want to stress that there is not a single person who is going to be more involved or more dedicated to your care and your health outcomes than you. And I want to acknowledge that it doesn't feel fair or right that so much weight should be put on you as the patient, the person with the medical condition, to now also have to do research and be informing yourself of everything. It's not fair. It would be amazing if your healthcare provider simply knew all of the best things and had all of the best recommendations for you. But it's just that's not the reality that we live in. So unfortunately, the best thing you can do to get yourself the best health outcome possible is to be as informed about your conditions as possible. You want to be as prepared as the patient in that skit, that when a doctor brings up a medication to you, you're already familiar with the possible risks and benefits of that medication because you've taken the time to proactively educate yourself about it. Now, that's not to say that doctors, I am not dissing doctors by any means, or any healthcare personnel. It's not to say that they're not informed. They're an incredible wealth of knowledge. We live in an era where, fortunately, new stuff is coming out all of the time. And that means that there's new stuff to learn all of the time. And there's only so many hours in a day. There's a point in time where something new has come out and they haven't learned it yet. There are a lot of patients, I will say, from being a healthcare provider, vast majority of patients who I deal with are not interested in obtaining that informed consent. They rather would just go along with whatever the doctor says. And so your healthcare providers get really used to that kind of interaction where the patient just kind of wants to be told what the doctor thinks should happen, and isn't asking those questions to make those informed decisions. So you have to also understand from the provider's perspective, how interactions typically go for them, and they're just kind of going through the typical motions. So always encourage you to know what you can about your condition and any possible interventions ahead of time, and never, ever be afraid to ask questions. And I just want to say again, if you're asking questions, and obviously I've talked about it before, the way that you ask questions is super important. You never want to come across as condescending or giving the impression that you believe that you know more than the doctor. I know I don't know more than the doctor. I know enough to know when to ask questions. If there's a doctor who is absolutely the expert in this one thing, I have mad respect for the amount of knowledge that they have. I just want to make sure that before I'm making any decision that I have a little bit of that understanding so that I can weigh out those pros and cons and make the right decision for me. on that note, what's the right decision for me may not be the right decision for somebody else. And maybe what the doctor is recommending would be the right decision for somebody else, and it's not for me. For instance, going back to that skit, Pitocin, you may or may not know, is a drug that's commonly used to augment labor. It's a synthetic form of the hormone oxytocin, which is what's released naturally in the body to induce and progress labor. A lot of times it was offered in this skit. A patient had been in labor for 18 hours. But one of her retorts in the skit was that first-time moms typically do labor for 24 to 40 hours. It takes a long time the first time you have a baby come out of you. And there's nothing, that's the average. And as long as mom is tolerating that and baby is tolerating that, it's the evidence is clear that the best thing to do is keep your hands off and let it happen. For everybody, though, that's not the best choice. And there's a lot of people who I've even met or heard their stories that, adding in that Pitocin and getting that labor to shorten was the best choice for them. And it makes sense then why the doctor would offer it. But the problem is that when an intervention is offered without a complete picture of the risks and benefits, because then that patient can't make an informed decision. And the last thing you want to do is be the unlucky patient who gets the side effects, who experiences the consequences, and you didn't even know that it was a possibility. Nobody told you. So always ask the questions, get the answers from the doc, and better yet, when you can anticipate something, inform yourself, read all about it ahead of time so that you can come to your appointment or, when the situation occurs, you can come into it with some background understanding, and then your doctor can help you fill it in. So that's I'm going to step off of my soapbox now. My wish is for everybody who comes across these videos, comes in my world, to understand the importance of being an informed patient, because I want the best healthcare outcome for you. And knowing as much as you can about yourself, your condition, the risks and benefits, and how to stand up for yourself and what to look for is going to keep you in the best possible place in the healthcare system. Please, no matter how hard it is, no matter how overwhelming it is, do not simply bury your head in the sand and hope for the best. Because in my experience, that's not the way it works out. So please, if you share this with somebody that you feel could benefit from learning this kind of material. And if you need the support of an independent patient advocate, please feel free to reach out however you're watching this video, or through Facebook, or directly on my website, www.herdforlife.com/for-patients. Thank you. Have a wonderful day.